Dr. Lowenstein, you're known for your natural facelifts. Do you mind telling me what techniques you use?
You want to hear about my techniques? Or you want to hear about my techniques versus everybody else's techniques or insanity? We just talked about, look, let's be honest, you just showed me something on social media about a deep plane facelift that was completely marketing ridiculousness. It was like a deep plane facelift in those terms where you connect the skin and the underlying SMAS tissue together, right? So there's a couple different types of facelift. There's a skin-only facelift. Stay away from that. There's no world that's a good idea. The SMAS facelift deals with the underlying tissue that has the connective tissue, and that's manipulated in a facelift. It's a great way to do a facelift. You can do it either on top, dealing with the SMAS from the top, or you can do it from the bottom. Then there's something called a composite facelift. That is where you have the skin and the SMAS together. That's what everybody else is calling a deep plane facelift. It's not any more of a deep plane facelift than a SMAS facelift where you undermine the SMAS, okay? Same thing, wording makes it all sound really wild, okay? What I do is an actual deep plane where in the mid-face, I actually go through my lower eyelid incision and take all of the tissue off of the bone and re-elevate the entire mid-face. It helps this. Here, I kind of need one. It would do that, see? Betting that this side of my face looks better than that side of my face, but repositioning the cheek tissue over the cheek, that is a rejuvenating deep plane facelift. Ask your surgeon about that. Not composite, but an actual deep plane facelift. So what I do is called a DeepFrame Facelift because I'm going in the deep plane here. I'm dealing with the SMAS. You can call it a deep plane here if you want, but it's not a composite. I lift the skin and then I do what is necessary for the SMAS. If that's plicating it because that's going to do best for you, then I'll plicate it. If it's undermining it and cutting some out, we do what's best for you for that. We're going to move that tissue up, not back, but up. This tissue from the lower lid, up in the deep plane. We're working in the deep framework of your face. And that's deep framework facelift.
Thank you.